Welcome back, everyone. We're going to continue our discussion on medical terminology, with this time looking at compound words and abbreviation. As a reminder that we need to be able to use the foundational, anatomical, and medical terms and abbreviations in both written and oral communication, communicate with our colleagues, other health professionals, and other agencies that may be with us helping care for patients while on scene. So let's start by breaking some words apart. Remember that we talked about the suffix, the prefix, and the word root. And by this point, you should be able to define each of those. Remember that the suffix is at the ending of the word, the prefix is at the beginning of the word, and the word root defines the term that we're talking about, most commonly to describe a position or portion of the body itself. So let's break down some compound words here. Nephropathy. Nephropathy. Nephro. Neph-o-pathy. Pathy, the suffix in this case, means disease. O is our combining form, and neph means kidney. So when we talk about nephropathy, we're talking about kidney disease. Let's try another one. Dysuria. Dysuria. We're going to break this down. Prefix, suffix, combining word. Okay. The prefix dys means difficult, painful, or abnormal. Ur, meaning urine, and ia, referring to a condition of. The patient is experiencing dysuria, or difficult or painful urination. Dysuria. Hyperemesis. For this term, we have a prefix and a root word. The prefix and root word break down into hyper and emesis. The prefix hyper means excessive. Emesis means vomiting. Hyperemesis, excessive vomiting. Analgesic. Analgesic. For this, we break down into three different parts. The beginning, an, means without, or the absence of. The root word, alges, A-L-G-E-S, means pain, and IC refers to pertaining to. Pertaining to the absence of pain, or without pain, or in a condition of not having pain. Analgesic, pertaining to no pain. This is commonly referred to a class of medications known as analgesics, or pain relievers. Abbreviations, acronyms, and symbols can also be used in documentation, and they're used for shorthand use for communication. They were originally developed for speed, but keep in mind to not trade speed for accuracy. Taking a look at the historic precedents of EMS and EMS documentation, when EMS reports were handwritten, we only had a finite amount of space to be able to document our patient experiences, or in our PCR, or patient care record. During this time frame, we were required to use abbreviations to ensure that we could get an adequate amount of information in a finite amount of space. With today's technology advances, we predominantly use ePCRs, or electronic patient care records, and the character limit is not nearly as strict as it was. So I would encourage you, while abbreviations can be helpful for note-taking or personal reference notes, to discourage the use of acronyms, abbreviations, and symbols within your patient care record itself. So don't trade speed for accuracy. Make sure that you're using only commonly understood acronyms and abbreviations so that you can minimize errors. And some agencies may limit the use of abbreviations altogether. Abbreviations will take the place of words to shorten notes or documentations. Again, make sure that you are only using the ones that are recognized and accepted, and be familiar with abbreviations in your service area. For example, a common abbreviation that's used, RX, may be used in place of a medication. You may also use common jargon abbreviations, or you'll see them as we discuss them within EMS and as we learn assessment techniques, or acronyms that are used. For example, the acronym AVPU, AVPU, which is used to describe a state of a patient's alertness. Alert to verbal stimuli, alert to painful stimuli, or unresponsive. You also may see a common abbreviation, ANO times 3, or alert and oriented times 3. Okay. But if you're going to use those terminologies to document, or those abbreviations or shorthand to document, you need to make sure that you fully understand what that abbreviation is referring to and that you indeed assessed those pieces. So again, would strongly discourage the use of abbreviations whenever possible, but sometimes they're helpful for shorthand communication. Same thing with symbols. They're often used as a shortcut, and make sure you're only using accepted symbols to avoid confusion and errors. And where we'll see this most predominantly, the abbreviator shorthand dosing for medications.